Listen, nursing children, and you will hear, as we tell the tale of Cipro clear. On a foggy day in '83, now people would be infection-free.
If infection is had in the skin or bone, patients in pain will sigh and moan. Hang an antibiotic on the IV pole before infection takes its toll. Oral takes more and less if by IV, and I on the opposite hall will be, ready to walk and spread the alarm through the Johns Hopkins village and farm, for the medical fold to be up and to arm.
Then he said, "Fluoroquinolones," with a roar, and took Cipro to the hospital door. Just as the moon rose over the bay, where patients at the bedside lay, bacteria waging war, a phantom, each podocyte and ribosome throughout the body like a honeycomb, an infectious disease that was magnified by its multiplication in the body's inside.
Meanwhile, the nurse through unit and hall waits and watches for physician's scrawl. Till the patient is diagnosed, the nurse at the bedroom door, the sound of orders, including the dose, away to the Pyxis on the floor.
Such a strong drug, the nurses would revel to understand its actions at a cellular level. 60 to 80% bioavailable, making bacterial DNA synthesis unsustainable. In tissues, it's quickly absorbed and shared widely, excreted through feces and urine, highly. Protein bound at 20 to 40%. Metabolism uses mostly powers, with a half-life of 3 to 6 hours.
Beneath on the unit lay the infected, in their hospital beds across the street, wrapped in silence so deep and still that he could hear environmental services groom, the watchful night nurse as she went, creeping along from room to room. Prophylaxis for an anthrax event, but watch, in pregnancy category C, crosses the placenta and may harm baby.
The nurse, impatient his duties to resume, clogged and scrubbed with a heavy stride, walked softly into the patient's room. Now he stood at the patient's bedside, saying, "Take with food if you fear GI ordeals, but not iron, zinc, or calcium-rich meals. Absorption of medication they'll impair. Avoid antacids 2 hours prior, and for at least 6 hours after entire. The tablet form should not be bitten, and run slowly to avoid infiltration. And lo, black box warning is written there. Patients with myasthenia gravis take care. Exacerbating muscle weakness or inducing psychosis. One hopes not for a misdiagnosis."
For adverse events, watch out. 1 to 10% patients will have a doubt. Neurological events from the CNS. Watch patients for dizziness, nervousness, insomnia, or somnolence, even fever, headache, or restlessness. Allergic reactions from rash to anaphylaxis. GI upset is common and possibly rhinitis. Cipro has been seen to increase the risk of tendon rupture or tendinitis.
To those anthrax exposed in events, if inhaled or touched with symptoms systemic, will get Cipro for 60 days hence, to slow progression and incidence of disease through the IV route, preferably, please.
Cipro treats pyelo for the children when UTIs have complication, unlabeled usage for CF, where acute pulmonary exacerbations are there, prophylactically to combat meningitis, and treating those with infective endocarditis.
When adults needed Cipro in Baltimore town, they had UTIs of uncomplicated cystitis and some chronic bacterial prostatitis. Lower respiratory infections abounded, nosocomial pneumonia, acute sinusitis, typhoid fever, neutropenia astounded.
You know the rest in the books you have read, but check CDC updates, don't be misled. For travelers' diarrhea, it's still approved, but not for gonorrhea resistant, it's proved. Adjust the dose downward for elderly folks, and the renal impaired or kidneys it provokes.
So through the night worked the nurse, and all through the night she silenced alarms and assessed signs of infiltration in all arms. An act of prudence and not of fear, a voice in the darkness, a knock at the door, and a word that shall echo forevermore. In the hour of darkness and peril and need, the people will waken and listen to hear the hurrying footfalls of the nurse and the Cipro message of this verse.